freedom. Because if we don't have freedom, and we don't have freedom to choose what we put into our bodies, what have we actually got? We have to have information, and honest, reliable information, so we know what we're doing, and we have to be free to choose without duress, without threat of losing our jobs, without threat of not being able to travel. Because if we are being told that we must do something under threat of loss of a freedom, then it is not a choice at all. It is not informed consent. It cannot be informed consent. We've been told repeatedly on mainstream media, including by our Prime Minister, that this proposed experimental mRNA vaccine that India has just rejected on safety grounds is safe and effective. Well, I say bullshit. It is not safe and it is not effective. Nobody can say it is safe or effective because the research hasn't been done. It's been approved in some countries overseas as an emergency precaution because of the imminent threat of this so-called virus that is reportedly causing illness. Now, there's a lot of assumptions in all of that, and I'm not going to go through all of them. But the very fundamental thing is, what do they mean by effective? Do they mean that if you have the vaccine, you won't get sick? Well, maybe they do and maybe they don't, but actually they can't tell us because they don't know. And they don't know how long we won't get sick for, even if we don't get sick immediately. Can they say, if we have the vaccine, we won't be able to spread the organism onto somebody else? Well, no, they can't say that, and they're actually very careful not to claim that because they know that they've got no research that will show that. So if you've got a vaccine that you don't know if it'll stop you from getting sick, and if you don't know if it'll stop you from passing this infectious agent on to anybody else, what actually does it do that makes it effective, apart from redefining the word effective to fit the government spin? It's certainly not effective in the sense that most of us would expect it to be effective. And they say it's safe. Well, normally these new vaccines go through many years, 8 or 10 years of trials before they're approved for rolling out on the public. In the past, when they've tried to make coronavirus vaccines, they've looked like they're working, and then when they've tested them on the animal, and when the animal's been exposed to the virus itself, the animals have got very, very sick, much sicker than they would have got from the original virus, because the vaccine triggered a hyperimmune response. It triggered the body to fight itself. So what have they done with this process? They've done a very, very shortcut process. They've only looked at effects over a very short time, and guess what? They removed that whole stage of the process where they tested with animals against the actual virus. They do not know what the effect will be on the body of somebody who's had a vaccine when they actually get exposed to the virus, if they're whatever the virus may be. How can that be safe? It's an identified risk. It's a serious risk that's triggered the end of a whole lot of these vaccines in the past, the use, and yet they haven't even tried to do the testing. So what have they done? If you've got any doubt about what I'm saying, have a look at the New Zealand Gazette notice for the provisional consent of the distribution of a new medicine. It's called Comirnaty, the COVID-19 mRNA vaccine. It's called Comirnaty because they have this group of people whose job it is, their career it is, to invent names for medicines that make them sound very good. And Comirnaty is supposed to make it sound like it's some sort of lovey, warm, cuddly thing for the community to help us. But when you actually read what's involved in it, you have to come up with a completely different conclusion. What the provisional consent notice says from the New Zealand MedSafe, which is a division of the Ministry of Health, it identifies 58 areas where more information is needed, 58 serious areas, all sorts of different testing on different aspects of safety and different information before it can be certified to be safe. So what do? They made these requirements that this information must be provided in some case by March 2021, so next month, and in many cases by July 2021. So the approval is subject to getting this information by March and July 2021. And yet a week after granting this provisional consent, they authorise this vaccine that has not been tested, and with these 58 critical areas of information shortage, to be rolled out in New Zealand. And as I understand it, today around New Zealand, people are sacrificing themselves under pressure from the government and under pressure from their employers to accept an injection of an experimental vaccine into their body. I've been really concerned about this for a long time. I've been asking the government a lot of questions. I asked the Minister of COVID, Christopher Hipkins, what ingredients are in the vaccine and what testing has been done. I've asked him what training the people are, the vaccinator squad, who have been rolling out around New Zealand to inject us with this vaccine. Well, he wouldn't tell me what qualifications they had to have be accepted into the vaccinator squad. He wouldn't tell me how much training they get during their vaccinator training, and he wouldn't tell me what liability they have under the Health and Disabilities Law if people are not given all the accurate information. What he told me was what my request, headed official information request, wouldn't be treated as an official information request. It would be treated as communication and correspondence with his office. Well, Christopher Hipkins, it was not a communication, was a communication with your office, but it was a lot more than that. You're legally required to answer my questions. And the fact that you try and avoid answering my questions makes me very, very concerned that you either don't know the answer or you're ashamed by the answer. How can an experimental vaccine, the people in New Zealand who are given this experimental vaccine, be given 2 hours training and then roll it out around the country with enough information to get informed consent? Especially when we know from the New Zealand Gazette notice that that information isn't even available. In New Zealand, they go an extra step to protect the big pharma and the vaccine makers. They won't tell us all the ingredients in the vaccine. So the manufacturers say, do not get this vaccine if you are allergic to the ingredients because you are at risk at anaphylactic shock. But in New Zealand, they won't even tell us what the ingredients are. So how is anybody to know if it's safe for them to have the vaccine or not? Yeah, you can find the information yourself, but you should not have to go away and search the information yourself. If you are asked to have a vaccine, I strongly encourage you to ask for the safety data sheet, ask for all of the information about all of the ingredients, ask for the health risks of each of those ingredients, but also ask for the health risks of each of those ingredients when they're used in combination with each other and in combination with different medicines. Because if you're taking different medicines, we know that vaccines can affect the effectiveness of those medicines, and those medicines can affect the effectiveness of the vaccine. But we don't know any of the specifics because none of the testing has been done to know which effects will cause harm, which effects won't. They won't approve medicinal cannabis in New Zealand even though they know it's relatively safe, because all of the testing hasn't been done about the interactions between all of the different drugs. And yet they're approving it, or they have approved an experimental vaccine in New Zealand. And not only have they approved it, but now they're effectively making it mandatory. How many times have you heard the Prime Minister on TV saying, we've got enough vaccine for everybody in New Zealand? How many times has she stood and said, well, actually it's unsafe for anybody under 16 because it hasn't been tested. It's unsafe if you're pregnant because it hasn't been tested. It's unsafe if you're breastfeeding because it hasn't been tested. It's unsafe if you've got a fever because your body's already fighting another disease and you definitely shouldn't inject it with something else. It's unsafe if you're taking other drugs for any reason. You might have a heart problem, any other problem. This vaccine has not been tested with any of those things. How many people are in those categories? How many times has our Prime Minister or anybody else stood up and said, actually, the vaccine won't work if your immune system doesn't work? So the very people who are most at risk from this so-called COVID infection, probably their immune system won't respond to the vaccine anyway, even if it does work to their very best hopes. So there are so many questions. So many questions. It's absolutely outrageous. It is so outrageous and so reckless what is being done. It's hard to find the words to describe it, because if you take a step back and think, this vaccine that India has rejected and that most other states that have approved it are doing it under imminent risk of COVID, where people are supposedly dropping dead in the street. But here it's very different. Remember, COVID was eliminated. What's the imminent risk of COVID in New Zealand? Why would anybody in New Zealand have an experimental vaccine that they don't know if it's safe or not? And why would any responsible public servant encourage anybody to have a vaccine that they don't know what it's safe or not? It's simply impossible for them to fulfill their ethical and legal obligations to the people that they represent, and at the same time ask them to trial an experimental vaccination that hasn't finished any of the safety testing when there is no imminent risk. Clearly the risk outweighs any possible benefit. Health and safety law. What do you have to do as an employer and what do you have to do as an employee? You have to identify risks in their workplace. If you're working in a field where you may be exposed to an infectious disease, then it's good to identify that risk. But you also need to identify the risk of taking an experimental vaccine, because that is another health and safety risk. Who's done some thinking on that? Who's assessed that risk? The answer, so far as I can ascertain, is nobody. So these are all just examples. My message, I don't care if you choose to have an experimental vaccine or not. That's entirely your business. What I do care is if you're misled into taking something injected into your body after being told that it's safe and effective, when actually that is a big fat lie and it's not safe and effective. That is my issue. I'm all for informed decision making, mindful decision making, and for the government sticking to what it needs to do and butting out of our lives, respecting our freedoms. That is what I stand for. So thank you all very, very much for listening today, and I'll hand over to Joe Raffici, who's also done a lot of work on this issue.
Thank you, Sue. Yes. You know, they asked a bunch of rats if they were going to have the COVID vaccine, and they were saying